Rhine refers to the nose, and itis refers to inflammation. So rhinitis is nasal inflammation. Allergic rhinitis is also called hay fever, because it's typically caused by allergens like hay, as well as pollen, dust, animal hair, or mold spores. Since the main trigger is pollinating plants, allergic rhinitis will flare up at specific times of the year. Allergic rhinitis is a type 1 hypersensitivity reaction, which is a type of allergic reaction that starts with exposure to an environmental allergen. So let's say that a bit of pollen enters the nose. It can get picked up by a dendritic cell, which is a type of immune cell that gobbles up the foreign particle and presents it to a nearby lymphocyte called a T cell. If that T cell gets activated, it kicks into action, producing cytokines which help to get other immune cells involved. The exact type of T cell determines the type of immune response, and in allergic rhinitis there's a bit of a T cell imbalance. There are too many T cells that, when activated, stimulate B cells, another group of lymphocytes, to produce IgE antibodies. Those IgE antibodies get released into the bloodstream and bind to mast cells, which are immune cells in the tissue that carry within themselves a load of histamine. Once bound by IgE, the mast cells are primed, meaning if pollen enters the body again in the future, those mast cells degranulate and release their histamine into the local tissue. The histamine causes blood capillaries to dilate and become leaky, which brings more fluid and immune cells to the area where the mast cells are located. Because the eyes and nose are portals of entry for infections, there are lots of mast cells around those areas for extra protection. So those IgE primed mast cells release their histamine, which causes nearby capillaries to dilate, flooding the facial tissues with fluid. Interestingly, there's evidence that early exposure to allergens might protect against type 1 hypersensitivity. For example, children who grow up on farms and have pets at an early age typically have lower rates of allergic rhinitis. It's thought that a combination of genetic factors and environmental factors like these contribute to which type of T cell group is most common, and thereby influences the overall immune response. The symptoms of allergic rhinitis are related to excess fluid in the facial tissues. It causes nasal congestion and red, itchy, swollen eyes with frequent bouts of sneezing. Symptoms can start just minutes after exposure to allergens and can persist for weeks at a time, affecting the ability to concentrate and sleep, as well as attend work or school. The diagnosis of allergic rhinitis is generally based on simply the way the skin looks, and when possible, it's helpful to identify the allergic trigger so that a person can avoid them in the future. One way to identify an allergic trigger is with a skin prick test, where small drops of allergens are placed on the skin and then pricked into the skin with a tool. Again, this is to see if there's evidence of an allergy like raised bumps or wheals, otherwise known as itchy red skin. These can test for a lot of allergens at once, but they can sometimes have low sensitivity as well as low specificity. In other words, sometimes a person might have no allergic reaction on the skin test, but have a localized allergic reaction affecting the nasal cavity and eyes. That's low sensitivity. Other times, a person might have a skin reaction to something, even though they don't normally have symptoms when they encounter an allergen in their everyday life, and that would be low specificity. Typically, the best thing for allergic rhinitis is to simply avoid the triggering allergen if possible. If there are symptoms, antihistamine medications can be used to suppress the effect of mast cell degranulation. Nasal irrigation can flush out the sinuses, which reduces the congestive symptoms of allergic rhinitis. In some situations, it's also possible to rewire the body's immune response to an allergen by exposing it to micro doses and slowly ramping up to a full dose of the allergen. This gradually boosts tolerance to the allergen by reducing the immune system's tendency to produce IgE each time. Alright, as a quick recap. Allergic rhinitis is a type 1 hypersensitivity reaction which results in inflammation of the eyes and nose. Airborne allergens like pollen, dust, animal hair, or mold spores cause mast cells in the tissues to release histamine, causing the eyes and nose to get inflamed and watery. Avoiding allergens is the best approach, but it's also possible to use antihistamines, and in severe cases, try desensitization to reduce or eliminate the symptoms. Thanks for watching. If you're interested in a deeper dive on this topic, take a look at osmosis.org, where we have flashcards, questions, and other awesome tools to help you learn medicine. Otherwise, you can always support us by donating on Patreon, subscribing to our channel, or following us on social media. A nasal polyp is a clump of epithelial cells that forms a small bump or overgrowth of tissue along the lining of the nasal cavity, which is the inside of the nose. The nasal cavity is made up of 3 regions. The first is the nasal vestibule, which is the area just inside the nostrils. Beyond that is the respiratory region, which delivers air to the sinuses and lungs. And above that is the olfactory region, which is involved in smelling. Lining the respiratory region are epithelial cells that create mucus to moisten the air and trap pathogens. There are also air-filled spaces within the skull that are on either side of the nose called paranasal sinuses, and these are lined by the same layer of epithelial cells as the respiratory region. The paranasal sinuses are named for the bones that house the sinus: the sphenoid, located next to the eyes, the ethmoid between the eyes, the frontal above the eyes behind the forehead, and the maxillary, behind the cheeks and below the eyes. Each of the sinuses normally produce mucus, which drain into the respiratory region. Holes at the back of the respiratory region, called choanae, act like funnels to direct the mucus into the throat to be swallowed. Nasal polyps develop when epithelial cells that line the respiratory region simply overgrow, a process called hyperplasia. Most of the time, 1 or more nasal polyps forms in the maxillary or ethmoid sinus. Nasal polyps can get large, the size of a pea, but they're usually non-cancerous, meaning they don't break through the basement membrane of the epithelium. Unfortunately, though, they often obstruct airflow as well as mucus drainage, which allows pathogens to linger in the sinuses and cause infections. Recurrent infections causes mucosal swelling as immune cells infiltrate the tissue and create an inflammatory response. This swelling makes airway obstruction and mucus drainage even worse. The reason the epithelial cells start to grow into a polyp isn't entirely clear, but they're associated with seasonal allergies, having frequent asthma exacerbations, as well as chronic sinusitis. There are some genetic factors that seem to be related as well. For example, individuals with cystic fibrosis and primary ciliary dyskinesia both have a high risk of developing nasal polyps. The symptoms of nasal polyps are usually related to blocked mucus drainage and obstructed airflow. As the polyps grow, they occlude the nearby choanae and block sinus mucus drainage. This can leave the sinuses full of secretions that get infected, causing bouts of fevers and headaches. Obstructed airflow can prevent air from reaching the olfactory region and decrease the sense of smell. It can also cause snoring and sleep apnea, and in young infants it can cause reduced levels of oxygenation, called hypoxia, which gives a bluish tinge to their skin color. Nasal polyps are diagnosed visually with nasal endoscopy, or by medical imaging with a CT scan. Diagnosis is often made after clinical symptoms become problematic, but changes to the respiratory mucosa can be detected even in their absence. The treatment for polyps is to shrink them using steroids, usually in the form of a nasal spray. The steroids act to decrease the inflammation and swelling from the polyp. But some polyps are unresponsive to steroids. This tends to happen when there are high levels of eosinophils, a specialized type of immune cell. In these cases, endoscopic sinus surgery might be needed to cut them out. Unfortunately, because the underlying causes for polyps are often chronic conditions like allergies and asthma, polyps often return, so repeat treatments are typically needed. Alright, as a quick recap, nasal polyps form as a result of hyperplasia of the epithelial cells that line the respiratory region, especially in the maxillary and ethmoidal sinuses. Their growth obstructs airflow through the nasal cavity and prevents sinus mucus from draining normally. They're treated with steroids or sometimes surgery, but have a high likelihood of coming back.
Hey guys, Vince here. So it's not very often you hear something described as large and the size of a garden pea in the same sentence. Of course, this is all relative to your sinuses, but I thought that was a pretty funny way to state that. Anyway, I hope that you found today's video on nasal polyps useful. The script was written by Amanda Greco, it was edited by Rishi Desai, Tana Marshall performed the voiceover, and I created the illustrations. If you'd like to support the creation of more of these types of videos, check out our website at osmosis.org, where you'll find flashcards and quizzes and other great stuff that'll help you learn medicine. Otherwise, you could always subscribe to our channel on YouTube or donate to us on Patreon. All right. Thanks a lot, guys. Bye.